Hi, my name is Brenda. I understand that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
Hello, Brenda. My name is Jay. I'll be your registered nurse today. I'm one of the many nurses here at the practice. It's Midwest Family Practice. Let me start off by getting some information from you. You probably noticed that I closed the door when I came in, so this is a private area. And let's see. Can I ask you your full name and birth date?
Brenda Sue Singer, 3/20/1964,
Okay, and your last four of your social.
4856.
Right? And do you have any known allergies?
Iodine, which causes anaphylaxis, and codeine.
Here. And let's see. As you can see, I'm a male nurse. If this proposes any problems personally, culturally, or spiritually, I would like to know.
No problems.
Okay, what brings you to see us today?
Well, I have a red scaly area that started out as like a pin dot, and it's grown to a nickel and or a dime, and then it went to a nickel. It's red and scaly
Okay, and where's that located?
on my left shin.
On the front side? Okay.
Yeah.
All right. Okay. Let me wash my hands and get some vital signs here.
Okay.
Have you been feeling warm at all?
No.
Let me just a little bit inside. Okay, 98.1. That's great. Let me get a pulse ox here. This will tell me your oxygen saturation in your blood, which is 98%, and that's out of 100, so that's excellent. And your heart rate is 72 beats per minute. Let me get a blood pressure real quick. Left arm. Make sure your feet are uncrossed for me, please. Thank you. I'll put my stethoscope just under the edge of that cuff there, okay? And this will be a little tight. All right. 120 over 80. Perfect. All right. Put these in just real quick. Okay, I'd like to ask you about pain. On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you ever experienced in your life, what would you say that is?
About a 2.
2. Have you been using any pain medication
No pain meds, but I do use Benadryl cream, 50 milligrams when it's itchy, and it seems to help some.
Benadryl, that's over the counter, correct?
Yes.
About how long has this spot been visible?
About a month and a half.
Have you felt any fever up until today? Any itching?
Itching, yeah.
Decreased sensation around that area?
No.
Have you noticed any difference during this season change from winter to spring?
No.
Is there any other areas on your body that seems to resemble this?
Not really, but I do have like rosacea that I was diagnosed with a while back, and then I have psoriasis cream that I use over the counter. I get red scaly areas around my hairline, around my nose, and on my chin. and that seems to help.
Have you started any new medications over the past month and a half or 2 months?
Well, actually, about 3 months ago, I started on an estradiol patch for hormones, menopause, and that's the only thing that's different.
Have you ever noticed any issues where you apply them patches?
No.
Any skin issues?
No. Mm-hmm.
Have you used any different laundry soaps? Any new clothing or footwear that might rub that exact area?
No.
Any outdoor activities lately, like hiking or any trauma or anything scrape or hit that area?
No.
Okay. Is there any family history or autoimmune diseases?
No autoimmune. My dad has had sun damage, that he's had some cancerous spots removed from his face and ears.
Okay, so that was skin. Let me ask you about your diet. Do you feel as though you follow a pretty nice, pretty good, healthy diet day to day?
Yes.
And how about your water intake?
It's good, but I could do better.
Okay, and 8 to 10 8-ounce glasses a day is what is recommended.
Right.
Just so you know. Okay?
I know.
Thank you. All right. Would you mind laying back and let me assess that area? Let me clean my hands and put on some gloves. All right. Just as you say, it's about nickel size, a little bit scaly, red, little little warmth here on each side and around. Don't seem to be raised in any fashion. Okay. Let me see. Let me check the warmth on the other side just to see. Now, the more I look, I think it's about the same. All right. Well, let me take a picture of that for your record. And as soon as this is downloaded to your record, we'll erase that from that camera, so there's no worries there. Okay.
Mm-hmm.
Okay, this information that I gathered so far, I just forwarded it to the physician outside. She'll be in here just in a few minutes to speak with you and see what we come up with.
Okay.
All right, I'll see you just in a little bit.
All right. Fair enough.
Hello, it's Jay again.
Hey.
Close that door. Yeah, I understand that the physician was just in and spoke with you.
Mm-hmm.
And what she wants to do is prescribe a steroid pill and a topical or a cream that you'll apply to the area.
What kind of cream is it?
Antifungal cream. And we have to remember when we use creams in containers that we never want to touch the tip of that tube to the affected area. Okay.
Mm-hmm.
We need to just apply it to a clean hand, clean finger, and spread it on as normal.
Okay.
Just keep that tip of that tube away from that area. Okay?
All right.
And also, she wants to refer you to a dermatologist or place a referral. 7 to 10 days, let's give it. And if there's no clearing of that area or it gets worse, go ahead and call the dermatology department at the local dermatologist.
Okay.
And that address, phone number, and things will be on your paperwork, which you'll take with you today.
Okay.
And then also there'll be our phone number for our office and after hour information in case something was to arise or look different after starting the medication. Okay. Just follow the instructions on each container of the medication. And what pharmacy do you use, please?
Walmart on Wilmington.
Is that Centerville?
Yes.
I got Beaver Creek here. Okay, I changed that for you.
Okay.
All right. Let's see. right. Any other questions or anything else that we can discuss while you're here today?
No, that'll be it.
All right. I have your paperwork for today's visit here. And like I say, here at the bottom is the numbers for dermatology, if so warranted. And any questions at all, please use these numbers here to call us.
Okay. Very
Very
good.
good. Well, nice meeting you.
Thank you very much.
Take care, okay?
All right.
Bye.